I'm Dr. Christopher Rayle. I'm a board-certified otolaryngologist and fellowship-trained laryngologist with SLUCare Physician Group. I see patients for a wide variety of ENT problems, and so anytime a patient comes into my clinic, we go through kind of a comprehensive evaluation of their ears, nose, and throat to make sure that there's no stone left unturned while we're trying to figure out how we can best help them. Anytime that a patient walks into my clinic, I want them to feel like a member of my family, and so that's how I'm gonna interact with you. I'm gonna ask you, not just questions about your medical problem, but also about your family and what you like to do and how the problem that you're having is impacting your life at home as well. And so I want everybody to feel comfortable when we're interacting in the clinic. The reason that I went into this field and specifically into laryngology is that we focus on helping patients be the best that they can be. Eating, breathing, speaking, all of these functions are big parts of what make us human beings and allow us to interact with those around us. And to be able to offer procedures and treatments to help people get back to doing what they love to do is what makes my job so meaningful and gets me to work every day.